Infection control is an ongoing process that promotes effective methods of prevention and control of infection. Its mission to protect patients and visitors from acquiring infections while visiting our clinic and minimize healthcare worker exposure while providing patient care. An individual's risk for infection depends upon how they were exposed, the strength of the infectious agent, the type and amount of infectious agent to which they were exposed, and that person's susceptibility to infection. At United Family Medicine, employees in certain job categories may come into contact with blood or other potentially infectious material and are considered at risk. They include nursing, dental, laboratory, X-ray, and front desk. Advocates should be asked to contact patients who present a risk by phone, but those who also serve as interpreters are included here, along with providers whose services we contact from ELINA. OSHA's bloodborne pathogen standard recognizes that blood and body fluids contaminated with blood present risk for exposure to HIV, hepatitis B, and hepatitis C. But blood is not the only consideration. Other potentially infectious materials present risk for acquiring these infections. They include semen and vaginal secretions, amniotic fluid, fluids that provide cushion, support, and decrease friction from surrounding organs, unfixed human tissue and organs, including non-intact skin, and culture media, cells, or any body tissue known to contain either HIV or hepatitis B. While saliva is typically not included, it is considered a risk for exposure both in dentistry and in instances where there has been mouth trauma. OSHA instituted a set of required workplace practices, universal precautions, to reduce exposure to these bloodborne pathogens. But OSHA's scope was limited. By considering only exposure to HIV and hepatitis B and C, a host of other pathogens encountered in our workplace went unaddressed. Standard precautions incorporates universal precautions and includes additional measures to prevent transmission from other sources. They include hand hygiene, safe injection practices, safe handling and decontamination of medical equipment and environmental surfaces, respiratory hygiene and cough etiquette, and use of personal protective equipment. Standard precautions are the minimum level of infection control precautions to be used for all patients and when handling potentially infectious materials at United Family Medicine. Hand hygiene is the single most important practice to reduce transmission of infection. Whether using alcohol-based hand rub or soap and water, proper hand hygiene covers all surfaces of the hands and fingers up onto the wrists. Alcohol-based hand rub is generally preferred to soap and water. To use alcohol-based hand rub effectively, apply a sufficient quantity to cover all surfaces when hands are rubbed together, so it takes 20 to 30 seconds to completely dry. Occasional soap and water wash should be used to remove emollient buildup. Under certain circumstances, soap and water is preferred. Soap and water should always be used when hands are visibly soiled. And because C. difficile forms alcohol-resistant spores, soap and water is also preferred when infectious diarrhea is present. Pathogens prevalent in the community at any given time may also call more appropriately for soap and water wash. United Family Medicine will monitor emerging disease information from the Minnesota Department of Health and CDC to keep you informed. For soap and water hand hygiene, wet hands with warm rather than hot water to prevent skin irritation. Add soap and rub together vigorously for no less than 15 seconds. Rinse thoroughly with fingers pointing down and dry with a disposable towel. Use the towel to turn off the faucet. Total duration from wetting hands through drying should take 40 to 60 seconds. Hand hygiene should be performed prior to and following any direct patient contact. Whenever hands become visibly soiled or contaminated, this includes coming into contact with blood or other potentially infectious agents, non-intact skin or mucous membranes, or contaminated equipment. Whenever gloves are removed, and when moving from one body site to another, gloves should be removed, hand hygiene performed, and new gloves applied. When entering a designated clean work area, this includes prior to preparing medications or procedure trays and prior to handling invasive devices. When entering or leaving the clinical work area, this includes arrival in the morning and prior to leaving for the day and should always follow bathroom or lunch breaks. And prior to and after personal contact, including touching eyes, nose or mucous membranes, or when handling personal care items. Gloves should be worn when exposure to blood, body fluids, or other potentially hazardous material is anticipated. When there is direct contact with patient's eyes, nose, mouth, or other mucous membranes or non-intact skin, when invasive procedures are being performed or a body cavity is explored either manually or with an instrument, and gloves are a requirement at United Family Medicine when giving injections. Gloves are considered single-use and to be discarded into appropriate waste containers when removed. They should be changed when the integrity of glove material is compromised, and are to be worn whenever caregivers have cuts on their hands or other breaks in the skin. They are to be removed from the wrist in a peeling fashion that turns them inside out to contain contaminated materials within. Personal protective equipment includes gowns, worn to prevent contamination of skin or clothing when a known or suspected infectious agent may be transmitted via direct contact, splash or spray, or exposure to airborne substances. Gown front and sleeves are considered contaminated. They should be removed in a peeling fashion, starting at the neck and shoulders, turning them inside out to contain contamination. During removal, contact should only be made with inner surfaces. Personal protective equipment includes masks. These are worn when a known or suspected infectious agent may be transmitted via exposure to respiratory secretions, and when there's potential for splash or spray. They should also be worn when caregivers have a respiratory illness. Type of mask worn is based on exposure risk. For illnesses spread by droplet, standard surgical masks should be worn within 3 feet of patients when caregiver immunity has not been established. Small particulate N95 respirator masks are worn when pathogens may aerosolize into airborne particles small enough to be carried on air currents and capable of penetrating surgical masks. N95 masks are required for all cases of active or suspect tuberculosis. Latent cases are not infectious. N95 masks should also be worn for protection when measles and varicella is suspect and caregiver immunity has not been established. N95s may also be considered when there's potential for aerosolization of pathogens during certain procedures that create heavy splash or spray. Respirator masks are not one-size-fits-all. They require customized fit and seal checking for leaks with each use. Fit testing and training is offered twice yearly. It's a good idea to keep a mask in your work area. Backup stock is kept in the cupboards across the hall from advocate offices. All staff members are expected to participate in fit testing when provided and compensated if they attend in their time off. Staff members who've attended sessions but cannot be properly fit should exclude themselves from care of patients with airborne illness. Masks should be removed and replaced when visibly soiled or wet. The face piece should always be considered contaminated, and removal accomplished from ties or elastic furthest from it. Personal protective equipment includes protective eyewear. This is worn anytime there is potential for splash or spray of infectious material. United Family Medicine provides masks with attached eye shields, goggles, and face shields. The front of used eyewear, like masks, is considered contaminated. These also should be removed from the back. Reusable goggles should be decontaminated prior to reuse. In the event eyes are inadvertently contaminated, they should be flushed liberally with water. Eye wash stations are located in the lab, yellow team soiled utility room, and in dentistry. Additional PPE is available on each team and includes head and shoe coverings. Guidance documents in place include strategies to prevent exposure. These include placing scheduling comments to alert staff of potential disease conditions, asking patients to mask on arrival, priority rooming, appropriate use of personal protective equipment, and good environmental cleaning practices which help to protect everyone. Recognizing risk and acting appropriately to prevent exposure is the basis for transmission-based precautions. It is a thoughtful process, and while guidance can be provided and policies written for infection control to be truly effective, communication is key. Scheduling notes, signs, and simple sharing of information between departments and individuals helps to prevent the spread of disease. Sharps include any item that can puncture, cut, or otherwise break the skin. Examples are needles, scalpels, lancets, and dental scalers and picks. Glassware and hard plastics that have broken, exposing sharp edges, are also considered sharps. Sharps are never reused, bent, recapped, or in any way manipulated by hand. Where present, sharp safety devices are to be engaged immediately following use. Two-handed needle recapping is expressly prohibited. Replacing needle caps may only be performed using a one-handed scoop. Sharps are to be discarded at their point of care in biohazard-labeled puncture and leak-proof containers that are stored in an upright position. Never reach into sharps containers and seal and discard them once they've reached fill lines. Avoid hand placement directly in the path of a needle when giving injections, and be sure to ask for help when needed to restrain children. Hands should never be used to handle broken glassware or hard plastics, even when wearing gloves. Pickups should be used, or borrow a broom and dustpan from the lab. And please let us know what you know. Provide suggestions to your manager or safety officer if you become aware of safer sharps options. Biological waste is regulated by federal, state, and local law. We have already discussed proper disposal of sharps. Regulated waste also includes liquid or semi-liquid blood or body fluids, and waste that may release contaminated material when handled. This includes saturated articles that may release material if compressed, and those caked with dried material that may flake when handled. It also includes live or attenuated human vaccines. Infectious cultures and equipment used to manipulate those cultures are also included. Biohazard labeling is required on all biological waste meeting criteria. When leakage can't be contained by primary containers, including red bags, it should go into secondary containers. These should be leak-proof, able to hold all contents, and be securely closed for transport, and display the biohazard symbol. Contact surfaces should always be disinfected between patient visits. Friction to physically remove visible soil or organic matter removes large numbers of microorganisms and should always precede disinfection. Protective underpads may be used to minimize gross contamination. But cleaning patient equipment isn't the only consideration. Also important is regular and routine cleaning and disinfection of environmental surfaces. Countertops, keyboards, and other horizontal surfaces should also be wiped down regularly. This includes those at front desk workstations. Spill kits are available in the team soil utility rooms, at reception desks, and in the lab. They contain instructions for biologic cleanup, personal protective equipment, absorbent and disinfecting agents, and biohazard bags. They should be restocked immediately following use. Only nursing, lab, and dental staff are permitted to clean biologic spills. Report bedbug sightings to your supervisor immediately. Fumigation is only ordered when bedbugs have been observed. Glove and collect a specimen if possible. This should be placed in a tightly sealed formalin jar and left in the affected room for the exterminator's inspection. Turn off exam room lights and seal lower door edges with table paper. Sign the room "Do Not Enter" with the date and time. Lobby videos may be reviewed to see if furniture was occupied. This should be placed in the room for fumigation also. Lobby chairs are heavy. Be sure to glove and ask for help with these. Doors should remain closed and articles left within following fumigation based on the exterminator's instructions. Viruses causing hepatitis B and C and HIV gain entry from contaminated sharps injury, contact with mucous membranes, or through breaks in non-intact skin. Hepatitis B and C viruses target cells of the liver. Acute phase symptoms may include fever, fatigue, loss of appetite, nausea and vomiting, abdominal pain, dark urine, clay-colored stools, joint pain, or jaundice. Both hepatitis B and C may occur without symptoms, and while either disease may clear entirely, both have the potential to cause chronic infection capable of ongoing transmission to others. Chronic carriers are more likely to develop chronic liver disease, liver failure, or liver cancer. Hepatitis B and C may survive on contact surfaces for 7 and 4 days, respectively. Hepatitis B vaccine is provided at no cost to United Family Medicine employees. It is safe, effective, and can prevent infection even when given after exposure. There is currently no vaccine for hepatitis C, but combination antivirals have been effective in eliminating the virus or decreasing viral load. The human immunodeficiency virus attaches to and destroys a type of white blood cell, the CD4 T cell. As these are destroyed, certain infections and some cancers that would not affect healthy individuals emerge, a condition known as AIDS or acquired immune deficiency syndrome. Symptoms may include dry cough, severe unexplained fatigue, rapid weight loss, recurrent fever or night sweats, and swollen lymph glands. There is no cure for HIV, but antiretroviral drugs can decrease viral load to preserve immune function. Risk from any significant injury varies based on multiple factors. Overall risks are presented here from a single needle stick injury from an infected source. No risk is considered acceptable under OSHA'S bloodborne pathogen standard. Even brief or seemingly inconsequential risk can result in disease transmission. While the vast majority do not, it is essential that you act. It's very important to excuse yourself and ask the patient to wait. In our experience, it can be difficult to get patients back for necessary blood work once they've left. Inform your manager immediately. They will engage the patient to have labs drawn. Act immediately also to cleanse the exposed area. For skin exposure, wash with soap and water a minimum 40 to 60 seconds. For eye or mucous membrane exposure, flush liberally with water and saline. As soon as you've cleansed the site, Obtain a United Family Medicine Blood and Body Fluid Exposure Red folder. These can be found in all nursing team stations, the lab, and dentistry. Protocols included in the folder outline responsibilities for employees, managers, and the lab. Complete the employee report included in the folder. Answers from the report will determine whether yours was a significant injury and steps that must be taken. Call Employee Occupational Health Service at 651-241-5693. Be prepared to answer questions from your report. Employee Health will conduct a confidential medical evaluation. If the injury occurs after hours, follow instructions included in the red folder. This may include evaluation in the emergency department at United Hospital. Evaluation and treatment is confidential and available at no cost. Aseptic technique is followed when preparing and administering all medications and for sterile procedures. Procedures should be performed and potentially infectious materials handled so splash, spray, and spattering is minimized. Shoes covering the entire foot are required in areas where invasive procedures are performed, blood and body fluids are processed, or hazardous materials are used. Mouth pipetting or suctioning of any material, including blood, is strictly prohibited. Manufacturers of multi-dose vials are only required to demonstrate sterility for 28 days after first access. For this reason, vials should be dated with first use and discarded after 28 days. Vaccines are the exception to this rule. Multi-dose vaccine vials should not be discarded and may be used until labeled expiration dates. Any vial marked single use should be discarded after first use. Soiled linens are collected in appropriately labeled containers, taking care not to overfill. Laundry should be handled to prevent exposure and contamination of personal clothing and personal protective equipment worn when appropriate. United Family Medicine maintains a supply of disposable scrubs should your personal clothing become contaminated. These are located in the provider coat room. Food and drink may not be stored in or on cabinets, countertops, bench tops, shelves, refrigerators, or freezers in laboratory or clinical areas. Eating, drinking, applying cosmetics or lip balm, and handling contact lenses in patient care areas or where patient supplies are stored places both patients and staff at risk, so is also not allowed. And smoking is not allowed in any area of the building. We work best when we work together and value your input to identify disease transmission hazards and share ideas for safer work practices to prevent infection. Please share your thoughts with your supervisor or safety officer. You may also use safety hazard concern forms found in the employee break room and place these in the suggestion box for consideration. We appreciate all your efforts to protect our patients, our staff, and the greater community.